Dissociative Identity Disorder, DID, is a complex psychological condition, often misunderstood, that is marked by the presence of two or more distinct personality states. Each identity may have its own name, age, history, and characteristics, leading to significant disruptions in memory, consciousness, and identity. This disorder typically arises as a coping mechanism in response to severe trauma during early childhood, primarily extreme, repetitive physical, sexual, or emotional abuse. Individuals with DID may experience gaps in their memory regarding everyday events, personal information, and trauma, which can be distressing and disorienting. These memory lapses are often misunderstood as forgetfulness, but are crucial aspects of the disorder. For those affected, these distinct identities, often referred to as alters, may take control at different times, altering the person's mood, behavior, and sense of self. DID is frequently confused with other mental health conditions, such as schizophrenia or bipolar disorder, further complicating its diagnosis. Mental health professionals often rely on meticulous patient interviews, case histories, and symptom assessments to accurately identify DID. Despite its representation in popular media, it's essential to note that DID is a legitimate mental health disorder with distinct diagnostic criteria laid out in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Therapeutic treatment for DID is often long-term and tailored to the individual's specific experiences and needs. Techniques such as cognitive behavioral therapy, dialectical behavior therapy, and psychodynamic therapy can be employed to help integrate the various personality states, providing a pathway to healing. This therapeutic process allows individuals to process traumatic memories and foster understanding and cooperation among the alters. Living with DID can be challenging, both for those experiencing the disorder and their loved ones. Friends and family may find it difficult to navigate the complexities of their loved one's identity shifts, requiring patience and empathy. Education about the disorder can aid in fostering understanding, compassion, and a supportive environment, which is crucial for the healing process. Finally, raising awareness about DID is vital for reducing stigma and providing proper support to those affected. Public education initiatives can enhance societal understanding and encourage open discussions about mental health, ultimately helping individuals feel seen, validated, and empowered to seek the help they need. By sharing knowledge about dissociative identity disorder, we can create a more inclusive world for all those who struggle with this complex condition.